Do you know what the leading infectious cause of death in industrialized nations is? It's not a new, mysterious virus or a rare, exotic parasite. It's a common respiratory condition that we've known about for centuries: pneumonia. Pneumonia is an infection that causes inflammation in the lungs. More specifically, it affects the alveolar space, the tiny air sacs where oxygen and carbon dioxide are exchanged, and the surrounding interstitial tissue. This inflammation can make it difficult to breathe and can lead to serious complications, even death. But how does one acquire pneumonia? The most common method of transmission is through the aspiration of airborne pathogens. These pathogens could be bacteria, viruses, or fungi. However, pneumonia can also result from the aspiration of stomach contents, a scenario that's more likely when one is unconscious or under sedation. The specific pathogens that are most likely to cause pneumonia can vary depending on a number of factors. These include the patient's age, their immune status, and whether the infection was acquired in the community or in a hospital setting. Pneumonia can manifest in two main ways: typical and atypical. Typical pneumonia usually comes on suddenly, and its symptoms include malaise, fever, and a productive cough. When a doctor listens to the lungs of a patient with typical pneumonia, they might hear crackles and bronchial breath sounds. On the other hand, atypical pneumonia develops gradually and is characterized by an unproductive cough, difficulty breathing, and extrapulmonary manifestations, which are symptoms that occur outside the lungs. Unlike typical pneumonia, auscultation of the lungs in cases of atypical pneumonia is usually unremarkable. In some instances, a patient might present elements of both typical and atypical pneumonia. To diagnose pneumonia, doctors may order blood tests for inflammatory parameters and pathogen detection in blood, urine, or sputum samples. A chest X-ray can also help confirm the diagnosis. In cases of typical pneumonia, the X-ray may show opacity restricted to one lobe, while in atypical pneumonia, the X-ray might reveal diffuse and often subtle infiltrates. Once diagnosed, the management of pneumonia primarily consists of empiric antibiotic treatment alongside supportive measures. These supportive measures can include the administration of oxygen and antipyretics, which are medications used to reduce fever. In summary, pneumonia is a common yet serious respiratory infection, and it is the leading infectious cause of death in industrialized nations. It can be caused by a variety of pathogens and can manifest in two main ways: typical and atypical. Diagnosis involves a combination of clinical examination, blood tests, and chest X-rays. Treatment typically involves antibiotics and supportive measures. Awareness and understanding of pneumonia can help in its prevention, early detection, and successful management.